about our
All right.
readers?
What do you?
They're amazing.
Aren't they?
I can't get over how much they communicate with us.
Mhm.
They're amazing on so many levels, and that if we were ever going to do a survey, the response is astounding. The comments, what gets me is that people take the time out of their day to share our content on Facebook, to write comments on our stories. Sometimes they do research before they write a comment.
Yeah.
They're really smart and really engaged.
And if we mess up anything, they point it out.
Oh, they do.
Right away.
Yeah.
Which is good.
It's actually very helpful.
Yeah.
It might hurt a little, but it's helpful.
Right.
Yeah.
I say that I want our readers to win the water cooler arguments. You know, not so that they can be smarty pants, just so that they can be, informed.
They're very engaged. I mean, it's just a loyal following.
Yeah, there's about 150,000 of them out there. So
So thank you,
Yeah, thank
everyone.
you all.
Thank
yeah,
you so much.
thank you. Oh yeah, we covered that in First Watch.
Yeah, more than that. I mean, I've had many people have known that I've been working on this, and with colleagues,
Yeah.
people will tell me that they saw it in that. Sometimes they can't distinguish what product they saw it in, but they can it had watch in the name or something. So I know that it gets out there because people really do. My colleagues anyway appreciate it, and they'll sometimes even specifically thank me for saying, hey, I saw that in that thing that you do. You still doing that? Yeah.
Right.
Which I take as a real positive. Yes, it's better if they know the brand and they know exactly how to find it all. But I think it's out there. It's expected. It's really part of their daily routine for many people. Right.
But it's all part of the family. It's all in the family, I guess.
Yeah.
By virtue of practicing right at the Brigham, I have lots of patients who are physicians or nurses or healthcare workers. So it's not unusual that they get Physician First Watch and mention to me, oh, by the way, I see your name on some of the stories I get, or my trainees say that, or some colleagues say that. But more frequently, I will have patients ask questions on studies. We will have covered the story days or weeks or even several months earlier. And oftentimes we cover stories that may not be changing clinical practice, but we know that the patients are going to ask about it. That happens a lot. I always chuckle because sometimes we even start the stories with, patient might ask you, even though we know that the association may not be causal, but the patients worry about it.
There are quite a few colleagues that I will bump into that will say, hey, look, what about this story that was posted? I even have one very close faculty member who obviously reads every morning, and he will send emails out to all his junior faculty with his comments on the articles that are posted, some of which are positive and some of which are like, what is this? This is not valuable. Or I even have one faculty member, he doesn't like relative risk reduction, and he always complains when anybody posts that or says that, because he's interested in absolute numbers, to show, is that really impactful? Is that really a statistically significant number? So every time that happens, I get an email like, why aren't you guys posting, absolute risk reduction and, number needed to treat or number needed to harm? Because I don't really care about the RRR.
We'd like to hear back from readers. You should tell your colleague who complains that he should write to us.
It's a great idea, although I think Amy would probably come back after about a week and be like, who is this guy?
Increasingly, I have colleagues contacting me to say, oh, I've seen your name, I appreciate the work you do with Physicians First Watch, etc. And that has definitely increased over time. I have seen it as well, where there will be a story that I know is relevant to patients I'm seeing or patients I will be seeing that day.
One of the memories that I liked the best was when I knew that we were on to something good. A pediatrician colleague, somebody I didn't know very well but who I interacted with, made a point of communicating to me that he had read a story that morning about ear infections and the management of ear infections, and a mom came in with a child with an ear infection. He was able to apply what he had read that morning in Physicians First Watch to that patient. And I thought to myself, that's exactly what we wanted to do. We wanted to provide information that was useful for docs that they needed on a day-to-day basis. That was perfect. I remember that very vividly, feeling like, okay, we did something, we did the right thing here.